Welcome to dBrief. Hi, this is Rashika, and I'm your host for the day. I will be taking you through the highlights of the webinar on a very vital topic on the occasion of World Heart Day 2020, which was recently organized by IMA TNSB and IMA Women Wing on 2nd October 2020 and sponsored by DG Shield. It is observed that the mortality rates due to stroke have declined in both rural and urban areas. But when it comes to heart disease, the slide is observed to be steeper in urban India. As per a study, more than 17 lakh people die every year due to heart attack in India. People seem to ignore the early indications, which are extremely vital to be properly diagnosed and hence treated. On the occasion of World Heart Day, DG Shield joined hands with IMA TNSB and IMA Women Wing to shed some light on the importance of healthy heart and early diagnosis of any type of heart disease. This session was kick-started by Dr. Nandini J, a consultant cardiologist at Mumbai Hospital, Vellore, who began to speak on the chosen topic, diet and exercise for a healthy heart. She started by sharing certain lifestyle changes that are extremely crucial and the facts that make women's body unique. She suggested different types of exercises as well as informed their impact on the body. At the end of her session, she began to share certain interesting facts. Let's dive into the video to know more.
This is a women's heart study, which I wanted to emphasize. There was an extended observational cohort study conducted between 2011 to 15. Women around the age of 72 years wore accelerometers and their daily footsteps were counted through these accelerometers. 16,741 women around the age of 72 participated in this. And the compare group was women who took a least number of steps in this group, that is 2,700 per day. These were taken as the control group. Women who took 4,300 steps had a 41% decreased risk for all-cause mortality. Can you imagine? It was 41% decrease in all-cause mortality when the steps were doubled from 2,700 to 4,300. And the risk dropped by 46% with 5,900 steps and by 58% for those with the maximum number of steps, that is 8,000. The risk for all-cause mortality fell by 15% for every 1,000 steps increase. So I just want to highlight and emphasize the importance of walking in women who, like most of us think that we are busy, we can't exercise, but definitely we should get our inspiration from Shanta ma'am, who has done all this at this age. At least either walking or some form of exercise should be started. And most of you have your phones, or you can have that accelerometer watch at home or at clinic and count your steps daily. Keep it aim to finish your target daily, either 600 or 800, whatever you aim for.
Dr. Amita Ganesh began his lucid speech on the topic, The Wonderful Journey of Music Therapy and Heart. He started off by sharing his experience in introducing music to patients. He suggested that preventive cardiology plays a vital role and also the ways how music associate with interventions. To understand how music can create a huge difference in a cardiac rehabilitation clinic, let's hear him closely.
What happens once the patient undergoes angioplasty or a bypass surgery? They just keep their hands over the heart and say, so I'm not able to do this, doctor, that doctor. But we have to give them the strength that unless they improve the quality of life, none of our medicines are going to work. So we assess them to improve their quality of life. Music therapy has a very important role. I always tell them, you listen to music. So what is the difference between hearing and listening? Sometimes what happens when you tell the patient you do yoga therapy, you do meditation, you do this, that, they become more stressful. Suppose they go and sit and close their eyes for meditation, they are not able to get meditation. They becomes more stressful. Then this meditation is no more a relaxation. So I tell them, you listen to music instead of hearing. The one word which differentiates hearing from listening is aha. When they say aha, which means they are listening. So definitely it has a major role, and we have observed in our day-to-day practice in Mahatma Gandhi how it changes their quality of life.
The webinar ended on a good note when Dr. Sumiti Sundar, director at Chennai School of Music Therapy, began to address the chosen topic, music and music therapy for women's healthy heart rhythms. She tried to address the need for music for cardiac health to support pathogenesis. She suggested the ways how music can act as preventive care for health and wellness. To understand the clinical outcomes of musical therapy in cardiovascular diseases, let's get the facts clear from her.
If you're going to see the clinical outcomes that has been indicated through research, it impacts the heart rate and heart rate variability positively. There have been researchers which have indicated, cross-cultural researchers which have indicated that it impacts the heart rate and heart rate variability apart from the systolic blood pressure and the diastolic blood pressure positively. And it reduces anxiety of patients in the pre-operative setting better than the anti-anxiolytic drugs. So this has been very clearly indicated through research that music works better than the anti-anxiolytic drugs and relaxing pre-operative music therapy intervention. So there are different kinds of music therapy interventions. And if you're going to look at relaxing music therapy interventions, it's about, the quality of music. The music has to be relaxing. The music has to have slow tempo. The music has to have a soft timbre. And probably, it's more of classical music that we are trying to use. Otherwise, in music therapy, we use different kinds of music because people react differently to different kinds of music. And so what music or the quality of the musical experience is what is important to be considered in the intervention. And if you look at relaxing pre-operative music therapy intervention, it reduces the prescription of anti-anxiolytic drugs. And there are a lot of randomized control trials which are being done to understand that the relaxing music interventions reduces systolic blood pressure, reduces diastolic blood pressure, reduces anxiety, reduces depressive feelings, improves mood, thereby also, reducing their anxiety. So there are stabilization of, physiological variables and also reduction of anxiety. And as Dr. We have, it's not only the data, the scientific data, which is established through research, but it is also that through practical applications, we have found out that when people are in local anesthesia and regional anesthesia, when they are able to, when they are in a sterile environment and when they are looking at, whatever is happening around them, and there are many anxiety provoking situations, even the environment can be very anxiety provoking to them. With music, it is possible that they may be able to cooperate well with a interventional cardiologist, specifically speaking with about the cardiovascular diseases and also the catheterization procedures. And stress reduction, resting in bed after open heart surgery, we have found out that also after the open heart surgery, maybe after for about 2-3 days, it is not possible for them to be very receptive to music therapy interventions. But after 2 days, it's possible that they can have a reduced perception of pain, and they also have reduction of anxiety. Their cortisol levels get reduced even resting in bed after open heart surgery. And it reduces the adverse effects, because considering 21st century has definitely made a different paradigm in understanding that the medical care has to take into consideration the mental health also, the connection between the mind and how the functions of the mind, like positive feelings and positive emotions and positive thoughts, can also impact the mind. And how through the brain information transfer systems like autonomic nervous system, the endocrine system, and the immune system are able to make changes, positive changes, behavioral changes. So in that way, when it has an effect on the mind or when the brain, basically if you look at music, it's such a rich experience. We can say that it is a multisensory stimulation engaging the motor framework. and it connects the different part of the brain. It's not just one part of the brain that is going to be stimulated when somebody is listening to music, or when they are going to be singing, or when they're going to be playing a musical instrument, or when they are writing a song and singing along with the therapist. There are multiple areas of the brain which are getting changed, and also they are getting connected. And apart from this, it's also the cognition and the emotion which is also influenced, and also the impact that it makes on the reward centers in the brain, the impact that it makes on the neuronal connections and the neural pathways, the communication that is happening with relation to motivation, or with relation to the positive neurotransmitters that are being secreted, like dopamine or oxytocin. So it is important to consider the biological. Lot of neuro science and neuro imaging studies with relation to music has indicated that uh, the brain functioning improves, different parts of the brain are stimulated, and it is more because of the mediation of the positive emotions and the positive cognition, which also plays a role in the functioning of the mind, which is contributing to the better functioning of the body, because biologically, through the hormones, with positive hormones, and also through the positive immune functioning, it is possible that they get into positive health behavior outcomes could be recorded. So reducing the adverse effects could be because of negative feelings or negative emotions or negative thoughts, which could contribute to the negative health. And if you have to look at positive health and improving quality of life, not only in the physical well-being but also in the psychological well-being of reducing anxiety or improving the mood or reducing the depressive symptoms and improving the sleep quality. Music therapy contributes a lot in stress reduction, and paves an important way to manage the patients, not only biologically but also psychologically.
Mr. Deepen Mehta, COO in DigiShield, took the chair where he discussed in detail how DigiShield is enabling doctors to safely and securely practice these testing times of COVID 19. DigiShield can conduct effective COVID 19 carrier risk screening of every patient before visiting clinics. You can log on for more information about DigiShield on www.digishield.me. To view the complete webinar, click on the dBrief menu. For now, this is Rashika signing off till next time. Stay safe, stay strong.